Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hi, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up, of course. Why not?
Love that. Well, speaking of living it up, the name of the show is Living Pain Free, and that's how we want our listeners to experience their lives, too. So if you are suffering from any kind of orthopedic or musculoskeletal pain, then you want to call Dr. Darrow during this hour here in our studio at 866-870-5752. That's 866-870-5752. We'll take your calls all hour long. And if you're not exactly sure what that means, we're talking about muscle pain, joint pain, tendon pain, disc pain, ligament pain, back pain, hip pain, neck pain, arthritis pain. And you may not even know where your pain is emanating from, but if you have stiff joints or dull aches or you think you have tendinitis or something like that, then give us a call. The number again is 866-870-5752. Right here in the studio, you can speak directly with Dr. Darrow. And please check out his website at www.lastemcells.com. That's www.lastemcells.com. You can email him off of every page on the site and watch the treatments on video. Very educational, and when you call today, the bonus, you get a free book, Dr. Darrow's latest. It's called Stem Cell and Platelet Therapy. Regenerate, don't operate is the byline. Now, it's actually got 264 scientific studies, and the foreword is written by the lovely Suzanne Summers. And there's even some information on hair growth in the book, if that's an issue that you're having too. So a reminder that we are here Saturdays at 10 a.m. and again at 1 p.m. And if you've been listening for a long time and you want to just call the office directly, you can do that 24/7. That number is 800-300-9300, 800-300-9300. So again, we're talking about musculoskeletal pain, which is basically orthopedic pain, and we have lines open for you right now to call the studio at 866-870-5752. That's 866-870-5752. What do you think?
Wonderful. I love it.
All right.
Would you mind if I take some questions until our callers start happening here?
Sure, great idea.
All right, this one says, is bone marrow painful? So we do quite a bit of bone marrow aspirations from the back of the pelvis. And the way we do that, and the reason we do it, is to gain stem cells and platelets at the same time. And we can inject those anywhere in the body to stimulate tissue to grow. So what we do is we have a person lie face down on the table. We use some lidocaine to numb up that spot. And that takes a couple of minutes to numb. And then we can put a needle into the bone. And people say, is that painful? Well, I did some yesterday, and I asked the person if they felt anything. They said no. But some people are sensitive just to the thought of it. And of course, they're going to think that there's some discomfort. I've never been able to do it to myself because I can't reach back there, or I would. But it's been very effective. I've done thousands of these over the years, and we get great results from it. So the basic answer to that is it's not a big deal. It's a very quick procedure. It takes me about 15 seconds once the area is numbed up to obtain the bone marrow. And the question goes on to say, hello, if I were to get stem cell therapy and wanted 2 different areas, my toe and shoulder, would it be 2 different extraction processes? The answer is no. We can do one extraction process and do many, many parts at one time if needed. And many people will, we always take a little extra because after the injections are done, people say, well, that wasn't bad. Can you also do, my back or my neck or something like that? And then we'll do that. And then the person says, and does that mean we are removing twice as much bone marrow? The answer to that is it depends how much we need for a particular area. So a shoulder needs about 10 cc's of solution. A toe only needs, a couple of cc's. So it all depends on what we're doing. And then the last part of their question says also, is this extracting bone marrow similar to a bone marrow transplant that is very painful? No, it's not similar at all. And when I wanted to learn how to do this for regenerative medicine using stem cells to regrow tissue in orthopedics, I went over to UCLA where I did my residency to the hematology department to watch some of their bone marrow extractions, and that is very painful the way they do it. I don't know why they do it that way. They're in a rush, I think, is basically what it is. And they extract a large amount of solution in a very short time. We're the opposite. We take a very small amount of solution, and we take time to do it so it doesn't change the pressure inside the bone. If we did that, it would be painful, but the way I do it is not. So that's the answer to that one. And should we go to Brenda, who has hip pain?
Let's do that. Yes, Brenda in Redondo Beach.
Hey, Brenda, this is Dr. Marc Darrow. How are you today?
Oh, whoops. I had to turn my radio down because I couldn't hear you.
Okay, cool.
Hello?
So how long has your hip bothered you for?
It's been bothering me for a few months. I had to move, and the place I moved into had a couple sets of stairs, and so I was carrying heavy bags and boxes up and down stairs several times, in one trip, and I hurt it, and it started hurting after that in the groin area and in the hip area. And then, of course, I have arthritis I have arthritis in my knees and my, just slightly other hip, too. I had them x-rayed, and they all said arthritis. But I have problems walking. It hurts so much. I have problems walking with my with my hip.
Do you mind if I explain a couple things to you, Brenda?
No, I would love it.
Okay. So arthritis doesn't happen overnight. And people have arthritis from usually traumatic or overuse, and they're both kind of related. So we get people in the office with arthritis all over their body, and sometimes that arthritis doesn't bother them. It means they have it, but it doesn't hurt. And then they'll have an incident like you had when you were moving and going up and down the stairs, and you kind of tweaked it. So was it the tweaking or the spraining of it, or was it the arthritis? They're kind of mixed up together. Maybe if you didn't have the arthritis to begin with, you wouldn't have tweaked it. With the arthritis, there often is overgrowth of bone and decreased range of motion because of that. And then if you get into ranges of motion that stretch out that joint, it's in a sense sprained or strained, and then you have pain thereafter. So I would have to take a look at you, and I don't really care that much about what the x-rays or MRIs show. I like to get them as a backup so I don't miss something and I'm safe. But I'd have to do an examination to tell you what's going on. It sounds like from what happened, we'd be able to help you, okay? And we'd probably want to use platelets from your blood or platelets and bone marrow which has stem cells.
Okay.
What
Yeah,
other
'cause,
questions do you have
sometimes
about
at night
that?
when I'm just laying in bed, the hips just
It aches. Yeah, that's common for arthritis in a hip.
Okay.
But it's also common for people that don't have arthritis. I remember when I was in medical school in Hawaii, I went scuba diving one time. And if you've ever gone scuba diving, you know there's great big fins that you put on your feet, and there's a lot of resistance. And most of the kicking comes from the hips. And and I had hip pain for quite a while. And I had the same thing. I'd lay in bed at night and I'd be aching away. And I was thinking, oh my God, I really must have hurt myself. But I was young enough that it just went away. And as we get older, some of these injuries or sprains don't seem to go away. And we need to jumpstart the healing using cells from your body of platelets and stem cells. So I'd have to check you out.
Back into exercising and getting,
Yes, you do.
I want to get healthy, and this is it's painful. I can't do any of that right now.
How many years young are you?
I'm 69.
Okay. Well, you're still very young, and there's no reason you shouldn't be back in shape again, doing your sports and taking care of yourself. And if you want to call the office now, there are people by the phones. The number there is 800-300-9300. I'll repeat it for people. 800-300.
I've got it.
But you're not the only one listening.
Oh, I'm sorry.
It's 800-300-9300. And for people that want to watch me do injections of stem cells and platelets in the hip or anywhere around the body, there are videos on the website, which is www.lastemcells.com. So that's lastemcells.com. And the nice thing is, on every page of that website, you can email me if you have more detailed questions, or just call the office and they'll tell you more specifically about what your issue is and how we do it and all of that information. Now, you also have arthritis in your knees, but do your knees bother you?
They only bother me when I stand, like if I'm sitting down and I stand up, or I can't, I'm having, I can bend over, but not without pain. Okay.
Same thing with that. I'd have to examine your knees and then see if you're a candidate for platelets or platelets and stem cells. And most likely you are. Most people are. We can help most people. We don't get everybody better. I'm not going to say this is magic. It's not. But it's been pretty magical on my body. I've done, I've injected my knees and my shoulders, my elbows, my right wrist. I've had other people inject my neck and back. And I even had, if you don't know my story, I had a shoulder surgery while I was in medical school because of pain from weightlifting. I stretched out my shoulder. And then the surgery made it really terrible. And then when I found out about regenerative medicine, I injected my own shoulder one time, woke up the next morning completely pain-free with full range of motion. And that was kind of a miracle healing that led me to do this work instead of doing surgery, because I was on the path to do orthopedic surgery. And then I was like, well, why do I want to do surgery on someone when I can hurt them? And the injections are so easy.
I have a friend that came to you about a year ago. She had recommended you, and she was having problems. And she went to you and got whatever needed to be done. You did it, and she's been great ever since. She's older than I am, and she's walking and doing everything. So she highly recommended you. So that's why I wanted to call and find out if I would be
Thank you so much.
Candidate.
Tell her I love her. Tell her I love her.
I will.
All right. Well, it's good talking to you, Brenda. We're going to go to George. Anything you have to say, Anita?
Yes. Thank you for your call, Brenda. Feel better soon.
Thank you very much.
And
God bless you.
And I want to give you the phone number, those of you listening who didn't pick up the phone yet, so you can speak to Dr. Darrow at 866-870-5752. That's 866-870-5752. And I have lines open for you right now here in the studio. Give us a call. How about George in Glendale?
Hi.
Hey, George,
Hi,
Dr. Mark Darrow. I
Hey,
understand
how
your
you
knee
doing, Doc?
bothers you.
Doctor, I've been listening to you for a year, and I should
What's
have
that?
come over about 6 or 7 months ago. Wait until you hear the story. I've listened to you. I know you use 30-gauge needles. I know you, if you're 10 pounds, if every 10 pounds, I know your formula, that you're putting too much weight on the knees and things that are hurting or whatever. I've listened to everything you said. And, Doctor, I'm
Good.
going to have to do penance on this one. I'm going to have to do penance. Whatever. This happened I'm 73 years old, 5'10", 180. And
Perfect.
I do a lot of walking. At least I did a lot of walking, Dr. Darrow, until the pandemic, because I used to walk to church and back about 5 miles a day when I wasn't
Okay.
when I was working. When I wasn't working, I just walked the daily mass. Okay, no problem. You know, a couple of years ago, I was trying to help a friend of mine dig out his driveway, and it was that 114-degree summer. Remember the 2 years ago? Well, at any rate, I really did a job on my knee. We were trying to dig out a driveway, dirt driveway, that had big buses parked on it for years and years and years. And we got into it a little bit heavier than we knew what was going on. And
Hey, George, I got a couple questions for you, if you don't mind me interrupting. I apologize.
Go ahead, Doc.
I've got your story pretty good. The question is, did you go to a doctor? Do you know what's going on with the knee? Have you had an X-ray, MRI?
No, I heard it clicking, and I stay away from doctors for the most part. And then when I heard you said it's not acute, as you described what an acute pain is, and you said a
Yeah.
lot of people have clicking, and some doctors tell them, oh, you need to have your knee cut open. And I said, I like this Dr. Darrow. He's not going to be a guy that wants to start digging in with a K-bar knife, you know.
No. I mean, obviously, if we can help you without surgery, we always want to do the most conservative thing in medicine. And the injections that I do are pretty conservative. The clicking,
And what I heard you talk about, I probably won't need surgery. Probably need stem cells, I guess.
well, we'll see.
I know you got to touch it. I know you have to come over there and make an appointment. You have to touch it. See, I'm ahead of you, Doc. I paid attention all this time.
Good. So, George, it sounds like you've got some patellofemoral syndrome with the clicking. That means that the cartilage on the back of the patella may be worn down a bit. That round bone on the front, the patella, slides in a groove on the femur called the trochlear groove. And when we beat it up, the cartilage can wear down, and then you get the clicking, and we can help rejuvenate that and regrow it with platelets or stem cells. So there's good hope for you. It sounds like you're getting around pretty good. So, George, God bless you. We're going to move on to other things, and I really appreciate your call, and we'll talk to you soon. Thank you very much. And, George, if you want to call the office, the number there is 800-300-9300.
All right. And our number right here is 866-870-5752. Lines are open for you right now to speak directly to Dr. Darrow.
Should I take another call?
Sure.
Before I do,
it.
I want to mention the vampire facelift, which is another way of growing tissue, but it's on the face. And my wife does that. I do the orthopedic. She does the aesthetics. That means making people prettier. But she uses the same solutions. You know, she uses platelets or stem cells to grow back the tissue in the face and plump it back up. As we age, the body dries out. People get shorter. The discs in the vertebrae that cushion them dry out. And I remember my dad was about 6 feet or so when I was young, and then as I got older, he got shorter than I did. And that's what happens. I mean, it's a strange phenomenon when we start shrinking, but that's just because the collagen starts drying out, and that happens all over the body, and we get injuries a lot easier. But the vampire facelift is a way of coming in the office, getting the injections in the face, and then just walking out, and usually by the next morning, people look real good. Also, we do hair rejuvenation, regeneration, growth, and that's the same thing. We put the same cells on the top of the head and help regrow the hair if that's something you want to do. So, this question is,
And we do have a call waiting, just so you know, before you
want
start
to do
your
that
question.
first?
Sure.
Okay.
Let's go
to Ricky's
in Lakewood.
Yeah. Ricky, Dr. Marc Darrow, how are you today?
I'm good, Doc. I just have a question with regards to my knee and my ankle.
I'm listening. Let's go for it. Let's hear you.
Are you there, Ricky?
Yeah. Oh?
Yeah, go ahead. We're here.
Yes. I've been having like knee problems and my ankle problems. I had a surgery done like 3 years ago with my knee.
For which?
My left knee. It was I tore my ACL, so they.
Okay.
They replaced my ACL.
Okay.
And then I'm a pretty active person, so I still engage in like sports activities and stuff like basketball.
Does your knee bother you now?
Yes, Doc. I'm actually a physical therapy by profession, and my problem is is my knee and my ankle, because I sprained my ankle probably 2 years ago. Same side, left side, and it seems like every time I engage in activities like running and stuff, it kind of bothers me, like it aches, and it's to a point where I have difficulty in walking. But after 2 days, I'm back to normal again. So I was wondering if that stem cell could kind of help me.
Probably. From what you're telling me, you may have you probably know this as well as I do as a physical therapist. The anterior talofibular ligament is the most common sprained. We're having an issue here.
Yeah, we have a little echo here. So
Ricky, I'm gonna take you off the air, but keep listening, and I'll give you all the information you need. The anterior talofibular ligament is on the outside of the ankle, and it's right near the lateral malleolus, which is the lump there, as you know, which is part of the fibula bone. And that's the most commonly sprained tendon in the body, or ligament in the body. And those are very, very easy using platelets or stem cells to heal up. It sounds like you just have a sprain, but sometimes they tear, and we can still help them heal. So it could be also you have the deltoid ligaments that are sprained or torn, which is in the medial or the middle part of the ankle, or maybe something else. I'd have to touch it and let you know. As you know, if you've listened to the show before, I don't treat based on MRIs or X-rays. I use them for ancillary information. I do like to get them, but I treat based on the person. I don't treat the MRI or the X-ray. I treat the person, and to do that, I need to examine the person and move them around and touch the areas. And the big key to healing someone using regenerative medicine is finding the pain generator. So, people come in all the time with arthritis, as an example, and I'll touch the area that's arthritic. They don't have pain there. So people come in oftentimes after they've had a fracture somewhere, and I touch the area where the fracture is. They have no pain there. But it may be an area close by where the pain is being generated from. So a very careful examination has to be done. Way too many surgeries are done without the surgeon touching the person's body. They look at the MRI or X-ray and say, look, there's the problem. Then they do the surgery and it doesn't work because they didn't hit the area where the pain was being generated from. So we have to be very careful. Whoops, time to go for a minute. Hang with us. We're coming back after the break for the next half hour. Thanks for listening.
We are. You're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this information coming your way, and give us a call at 866-870-5752, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.